it's actually a great opportunity to raise and discuss one of the very lively topics that emerged, and particularly after the lockdown, and actually the significant increase in the rates and percentages of mental health disease. Now, it comes as a very logical extension to this month of Ramadan, the blessed month of Ramadan, whereby we are more prepared to look into ourselves, rectify ourselves, and then seek avenues for improvement, for enhancement of our well-being, spiritually, physically, and mentally. Today, inshallah, we're going to be discussing the mental aspect, um, um, tying that between science and Islam. We've got, alhamdulillah, distinguished guest speakers. That is Dr. Ahmed Abdul Hamid, who's a psychiatrist. He is also a founder of La Tahzan Foundation in Coventry, and that helps with the society mental well-being. We've got Mr. Ziad Al-Jaroushi, who is a psychologist, and then he's submitting his master's in psychology. He's also got his endeavors in the society, both on the psychological, social levels. We've got also joining us Dr. Wael Fuad, who is a psychiatry consultant who was trained in Liverpool, so he's not far off his own society, and then moved to Dorset as NHS consultant before moving a little bit further to Dubai, where he subspecialized also and focused his practice toward youth and addiction. So without further ado, really, we've got a few things to go through today, inshallah ta'ala. Our seminar is going to be between 2 and 3. The theme is going to be Islam, science, mental health, disease, and well-being. The points we're going to be highlighting and discussing: first, an introduction to the history of mental health illness and management of mental health disease, both in medieval ages and Islamic civilization, and what's the origin of that as it stands. 2, we'll go then to the main bulk of this. The question is, if I or one of my loved ones or one of my family members have got mental health illness, how can I recognize this, and what should I be doing? What is the stigma? What are the signs and symptoms? What things can what is the red flags for me to kind of highlight this to and seek specialist advice? At which level talk therapy would be enough? At which level then we need to go for counseling, and at which level we need to go for further specialist psychiatrist advice? And then we move to then the third axis, which is going to be now, what's our roles, or what are our roles as individuals and families, and then as society institutions, to support our community and our fellow community members who have got mental health issues. And then there is a Q's and A's, and finally there will be a kind of a nice surprise to our society, inshallah rabbil alameen. So without further ado, I'll just invite our two guests, Brother Ziad and Dr. Ahmed, to give us some sort of a quick highlight of things about history of mental health management. We know things about, we hear things about the madhouse, the mid 50s. What's the history of management of mental health illness here in Britain in the 50s and 60s, and how did that progress till the current situation, and then Mr. Ziad is going to follow on that from the Islamic civilization aspect. So, Dr. Ahmed, it's you, and I've got 5 minutes to do that. No pressure.
Bismillah ar-Rahim. Jazakallah khairan for inviting me for this meeting. It's really important. I think, I mean, this is now is the time to start discussing these issues about mental health and how this relates and how this resides in our Islamic and our civilization in general. So as you've mentioned, so mental health is quite an important topic now, and the history of mental health or the mental illness goes back to the existence of humans, really. So we know that the mental illness has existed side by side to the existence of humans themselves. We've got different records and different texts from ancient civilizations, including the Egyptian, the Indian, even in the Bible, in the Greek and the Roman text, speaking about the mental illnesses. However, the origin of the mental illness, I think we've got a much better understanding of the origin of the mental illness now in the modern era. So before, I mean, in the past, there was a belief that the mental illness is due to the possession of demon. So it's kind of superpower. So something is controlling the body of the human, and that this theory led to different practices. In ancient Egypt, for example, they used to drill a hole in the skull, I mean, to get the demon out. So that was kind of the way to get the demon out, is to drill holes in the brain. And we've got some evidence that the skulls discovered in different parts of Egypt have got that evidence of that treatment. That has improved over time. I think the first leap in understanding of the origin of mental illness came from the Roman and the Greek civilization around the 490 before Christ BC, and that's when Empedocles, one of the scholars, started to point to the human origin of the mental illness, saying that the mental illness is not superpower, it's something due to a problem within the body. And he came up with a theory called the humoral theory. And basically he said the mental illness is due to imbalance in 4 bowels inside the body. He said there are like 4 body components: the black bile, the yellow bile, the blood, and the phlegm. And that led to some practices which we've seen even in the early Islamic civilization as well. Things like restoring the balance between these 4 components by bloodletting. Sometimes we call it the hajama. So because that was believed, this is due to the imbalance between these 4 components. And one way to do it is if the blood power is high and it causes some stress. It was believed that this is the reason behind the mental illness. So they started doing bloodletting, venesections, and similar practices. Also, the work of other Greek scholars, including Hippocrates, I think he pointed to the same thing. So he said that the mental illness is totally within the body of humans. It's not due to the superpower. And I think that paved the way for the Islamic scholars, because we know after the fall of the Roman and the Greek Empire, Muslim scholars started to translate many of these manuscripts. And I think that paved the way for many scholars to start thinking in mental illness in that way. It's not a superpower, it's not jinn, it's not demon, it's something happens due to a problem inside the body. So I leave this bit to Brother Ziad to tell us more about the Islamic civilization, but I will jump to the 17th and the 18th century here in Europe. So during the Dark Ages, there was a point of view that regardless the cause of the mental illness, we need to segregate these people because they represented a risk to the community. They've been violent, they've been behaving bizarrely. So the main motive behind the dealing with these people was to segregate them from the community. And that's when the bad asylums origins. So the lunatic asylum is a term used to describe the institutions that hosted those people. So, and these, at the beginning, they were private houses. They weren't belonging to any local authorities or anything. They were private business, because families at that time were responsible to look and to care after their members. So they thought that this is your responsibility. You ought to look after your insane people. So the private business came up to do this. And the problem with the asylums, they weren't really controlled by any quality standards. And then we started seeing and reading about bad things happening to people in these asylums, including chaining them, hitting them hardly. There was a common practice of hydrotherapy, when they used to submerge the patient in a very cold water. And the idea was this cold water is a kind of desensitization, and it helps people. So we've got very tragic stories coming from these asylums until the early 18th century, when there was a call for moral treatments for those people. One of the things that was happening in those islands as well, they became, it's because of the business motive behind it, they became a source of income for these private houses. They've been selling tickets for people to come and watch those mad people, like, or lunatic people. So if you pay like £10, you go and have a tour, and you might be allowed to feed them. So something like an animal zoo, really, more than a human institution. But I mean, towards the ends or the earliest of the 18th century, started a movement calling for that moral treatment of those people, and that's when we started seeing calls for like a community-based treatment, and I think around that time there was the first hospital in Europe, led by one of the very known psychiatrist called John Conley here in the UK, and he was kind of mobilizing this movement to have a community-based treatment for those patients. And out of this call, there was the first established, I think, asylum without a change and without locked doors, which is currently part of London Mental Health NHS Trust. I think around the same time, the Americans. Yeah, I'm almost finished. Yeah, so I think around the same time as well, the American psychiatry movement led by Benjamin Rush, they've been like adapting the same situation, like calling for community-based treatment, and starting with the end. Like towards the end of the 18th century, there has been a strong movement in psychiatry calling for this community treatment. But at the same time, psychiatry became a prominent branch of medicine. So it's currently a branch of medicine, and backed by what we call the neuroscience. So the neuroscience is the research behind it, behind the psychiatry, and based on the neuroscience, we are now able to understand the different dynamics and things happening in the brain. So that's kind of a brief history of.
Thanks so much. It's really quite interesting really subject, and it's a quite a big eye opener really about what's happening and how much it is quite advanced, and we are quite blessed with this science and then advancement. I'm sure that as you just mentioned, and all this effort and quality monitored mental health management. So what about the Islamic civilization then? Now, what about the Muslim scholars? What's their contribution in that? I mean, was it anything to do with mental health? And is all what you know about Muslim scholars are those who kind of surgeons, or kind of mentioned few internal medicine in general, or have we got any kind of a contributors to mental health management in particularly and specializing in that? So Brother Ziad, if you can just highlight this please for us.
Jazakallah khair, Dr. Adam. Absolutely. When we start talking about mental health in Islam, we started from our beloved Prophet Muhammad alayhi salatu wasalam. He was, when companions has challenging behavior and emotion, he was always have active listening, he showing empathy and counseling skills to provide help to them. And we all know the story about the young man who came to Prophet Muhammad alayhi salatu wasalam, and he said, "Give me permission to commit zina." And the Prophet, all the Sahaba said, "Mah, mah," to him. But Prophet Muhammad ﷺ, he said, close to me, idnu minni. And when the young man come near from Prophet Muhammad ﷺ, he asked him, would you like it for your mother? And the young man said no. And Prophet Muhammad answered him, people wouldn't like it too to their mothers. And then he asked him, would you like it to your sister? Would you like it to your daughter? Would you like it for your auntie? And each time the young man saying no, and Prophet Muhammad answered him, people also wouldn't like it for them. And after this, Prophet Muhammad, he gave him a nice dua where he said, oh Allah, forgive his sins, purify his heart, and protect his chastity. So what we see in here, Prophet Muhammad, he didn't say, go, this is shaitan, this is waswas, go and pray 2 rak'at, or just be patient and go fasting. No, there's an issue here, a need to solve by talking therapy, that you need to change some thought in this young man. And what that Prophet Muhammad did, and after this, he gave him support in what we said, faith support by the dua he gave him in the end. Going forward to the golden age, and we have loads of doctors, scholars who talking about mental health, like Abu Zayd al-Balkhi, like Ibn Sina, Abu Bakr Razi, Farabi. And here I will just mention 2 names. The first one is Ibn Sina and his great book called Al-Qanun in Medicine. In this book, he wrote types of therapy, and he mentioned illness like epilepsy, stroke, depression, and he gave some description from herbs. And one of the famous one called Leg of Heart, Asbat al-Qalb, and they use it nowadays for healing from depression. Ibn Sina, he also was pioneer in psychosomatic, the field who focus on the psychological changes and how it's influenced in physical illness. The second scholar is Abu Bakr Razi. So Abu Bakr Razi, he was a director of Baghdad Hospital, and he was the first manager of mental illness department in the world. So that was the first department for mental health illness. There's amazing thing happening in this department. First thing, the patient, he has 2 companions with him, and he has professional doctors always. People who has difficulty sleeping, they put him isolate in private rooms, and they give him a skilled storyteller, give him a story to sleep peacefully. That's amazing. And other things they do in this department, like massage therapy, music therapy. And when we talk about music, not the music that we know nowadays, but they talking about like sound of water, sound of birds, like nature sounds. Also, after these patients discharged from the hospital, and that's the amazing thing, when they discharge, they give them 5 coins of gold to start independent life after the healing. That's amazing. Also, Abu Bakr Razi has a nice book called Al-Hawi, and in this book he mentioned the link between mental illness and the psychological, physical illness. And he believed that alham, what we call nowadays stress, one of the causes for stomach disorder. Finally, what I want to say, as a Muslim nowadays, we shouldn't not be afraid of or ashamed to talk about our mental health issues and seek help from the specialists, as our scholar before did, and in the golden ages. Barakallahu feek, Dr. Adam, Jazakallah khair.
That's really great. I mean, we are moving to kind of from one great aspect to another one, actually, to and how this art of medicine and of management has progressed over the years, to the point that it became such a sophisticated one nowadays. Then a few things actually we're going to be addressing Dr. Fouad now. So okay, we jumped to history about mental health being. What does it mean to us? What does it mean to me? How can I maintain my mental health being? I know how to look after my body in terms of food, sleep, exercise, dieting, and so forth. But how can I look after my well-being of my mind itself? How can I make sure that I run more or less a healthy lifestyle that doesn't get me through stress that I can't cope with? Then what's the coping strategies for that I can use in this day and age? I mean, dealing with studies, work, as all around us. So few things really comes to mind, and then in particular, then if there is a person with got an issue in terms of the mental health, kind of a hiccup or not very well, then how can I recognize this? How can I not say, oh, this person is badly mannered, he's behaving badly, and separate that and highlight and understand that this is someone who needs actually support rather than kind of a skeptical or sarcastic or dismissive attitude. So these are things really that we really want to know, and it's about the know-how of things. And so it's really Dr. Fouad, if you can just share with us your presentation and then take it from there in terms of the points that you want to highlight.
Jazakallah khairan, Dr. Adham. It's such a pleasure to be with all brothers and sisters from Liverpool and beyond. Wishing you first a very blessed Ramadan and blessed mercy days of Ramadan. The first 10 days of Ramadan are showers of mercy. Wishing that Allah blesses all with His mercy. What a beautiful introduction from you and Dr. Ahmed and Brother Ziad in the build-up to my presentation. But I ask you to allow me to share the screen, Dr. Adam, if it is okay.
Okay, yeah.
Perfect. And it's such a big issue. I'll do my best really to go through it within the constraints of time that we have. These are my qualifications, and if I just, can you see my screen first, Dr. Adam?
Yeah, we can. Yeah, that's very clear.
You can hear me?
Thanks so much. Very clearly.
So let's start with quick facts from the WHO. This is World Health Organization. It states that mental and substance use disorders are one of the leading cause of disability worldwide. We'll be modest here. We're not going to say that they are the leading cause, but they are one of the leading causes of disability worldwide. About 800,000 people commit suicide every year. So that's one person committing suicide every 4 seconds. And it's such painful to hear that the second leading cause of death among the age group 15 to 29 is suicide, unfortunately. Mental disorders are important risk factors for other disease, I mean physical health problems. And we all understand and appreciate the stigma and discrimination about mental health problems, even in the West, till this very day. I don't think it can be any more painful to hear that than to hear that 1 in 5 children worldwide, children and adolescents, have mental health problems. So what is mental health? Let's start from the very beginning, taking a step back. Well, it's mental health. It's more than just the absence of mental disorders. It's that state of well-being in general. Okay, so living your life really to the full, enjoying your life to your full potential. Okay, and that's again WHO kind of definition. It's an integral part of the health. And by the way, it is built into the WHO constitution that health is not merely being completely physically and socially well, but it's also being mentally well. and is determined by a range of factors. And for those who have studied psychiatry, we always talk biopsychosocial. So there are biological factors, there are environmental factors, there are social factors which contribute to mental illnesses. And that's quite important when we talk about how we are going to address mental illnesses. It's not only addressing it using medications. So, for example, when we talk about social problems or environmental problems, social problems like violence certainly increase the risk of mental health problems, and maybe a clear evidence is with sexual violence. In cases where there is a rapid social change, like in cases where there are local conflicts and mass migration of people, we do recognize there is a surge in mental illnesses. As in the case with stressful work conditions, social exclusion, or gender discrimination. It is the case that some mental health conditions do have biological risk factors, and these risk factors are included in the genetic makeup of some people. So how do we go around it as specialists or scientists around in terms of studying mental illnesses for those who present to us? Well, this is the part of the major part of those who train to be psychiatrists, understanding psychopathology, which is a study of abnormal experiences in the cognitions, in the behaviors and feelings of people who present with mental health problems. And we do claim that's probably the fundamental skill of a psychiatrist, to diagnose a mental health problems. And this book, Sims Psychopathology, I think this book brings us nightmares, isn't it, Dr. Ahmed, until this very day, for those who have been going through the earlier days of training and having to study such a book to pass our exams in our earlier days. Okay, psychiatry in the UK belongs, the training scheme belongs to or is supervised by the Royal College of Psychiatrists. This is a form of what we go through in an initial assessment. As you may appreciate, it's a very, very comprehensive form that goes through literally everything in a person's human life, probably from the point he was born or even before. We do ask actually if a patient's mother had any problems during pregnancy or giving birth. And it goes categorically through a developmental picture, in an attempt to try to understand the person in front of us from all aspects before we do our mental state examination. So if a medical doctor examines your chest or your tummy, we examine the mind through doing a mental state examination. And these are the items we look into before we decide what if we think a person has a diagnosis of a mental health problem or not, and before we diagnose, we give a diagnosis and the management plan. This is the book that we abide to in giving our diagnosis, the ICD-10, the International Classification of the Disease, in its 10th version. And our mental health diagnoses lie in the 5th chapter of it, the F symbol. So these are literally all the mental health diagnoses that you may come across if you are facing a patient with a mental health problem. Notice that this earlier part is people who may suffer from dementing illnesses, dementia. So this is the skill of our colleagues who do elderly psychiatrists, whereas the later parts largely fall into the skills of those of our colleagues who do child psychiatry, child and adolescent psychiatry. And just a little bit of correction, I am a general adult psychiatrist who specialized in doing substance use disorders. So this category, but I can as well help with diagnosing other parts. And without wasting a lot of your time, I'm just going to whiz quickly through the major diagnoses we come across. Obviously, depression is one of the most prevalent conditions. A person needs to have at least 2 weeks of very low mood, that's depressed mood, with loss of interest or pleasure, and with what we call biological symptoms of depression, things like loss of sleep, loss of energy, loss of weight and appetite, feelings of worthlessness, and at the very extreme, even suicidal thoughts or attempts. And this is what we try to look for in an attempt to match patient's symptoms with signs before we give a diagnosis. I always thought, obviously, in our learning of psychiatry and practice of psychiatry, we have to follow the sort of orthodox teaching in the UK. But I always remember when I'm seeing a patient with depression in particular, the hadith of the Prophet ﷺ that's there in the Sunan Abu Dawood, Allahumma inni a'udhu bika min al-hammi wal-hazan or wal-huzn. So actually the Prophet himself, the best person on earth, the most resilient person on earth, was asking Allah for protection from worry and grief, or what we call probably in nowadays term, anxiety and possibly depression. Okay, so that's to say, even in our religion, it's built in that depression can be there, and we ask Allah for protection against it. Anxiety disorders, it is another quite a prevalent condition with many subtypes of this family of disorders, probably social anxiety disorder in particular being the most prevalent among the anxiety disorders. But it's a big family, and goes without saying that the main symptom from a patient there would be excessive anxiety and worry. I won't go much again. It is there, and I'm happy for my presentation to be shared for those who are interested, if you want to go more into depth of what I'm discussing today. And again, to give a diagnosis, we need to be more specific according to the criteria we give a diagnosis against in terms of time factors and according to specific symptoms. You may know someone who may have problem with generalized anxiety disorder, where anything may be triggering anxiety for this person. A panic disorder where people are getting recurrent panic attacks. Agoraphobia, it's interesting, this name agora, as in the wide space, the open space for the Greeks. So that's phobia, fear of open spaces. Okay, and social anxiety disorder. Obsessive compulsive disorder, and particularly for us as Muslims, we may have heard of stories of people who need to be doing things in particular rituals repeatedly, as in, say, for example, doing ablution or not being sure if they have done their prayer in the correct number and having to repeat it to kill their anxiety or to overcome their anxiety that they may not have done it properly. PTSD is another kind of anxiety where there is a trauma, and there needs to be quite a significant trauma, and the person can't seem to pass this trauma, so avoids the whole situation, which may get him any closer to his memories. He may be re-experiencing memories of this trauma, and certainly may be getting repeated arousal and hypervigilance when remembering this trauma. But these are not necessarily the most common. I would probably argue, even for me as a psychiatrist in the UK and doing secondary care, probably I was seeing probably a lot of adjustment disorder and other conditions. Certainly there was a lot of people with depression and anxiety, but there was also quite a lot of people with adjustment disorder. And I think if you ask our colleagues in primary care, probably this is what the most common condition they would be coming across. So it's really that degree of anxiety or depression which happens in response to a significant stressor in our life, but it is self-limiting. And as much as tempting it would be when you see a patient with anxiety or depression to give treatment for these symptoms, this is really that comes with skill that you need to hold on. Assurance and giving psychological support and other guidance can on its own help people overcome an adjustment disorder without having to go on to treatments. Psychotic disorders, and that's probably what catches the light when you think about psychiatry, or the common sort of misnomer about, or the common word that people with psychiatric disorders are crazy, largely because of the perception of the vast majority of people that being a psychiatric patient means that you are hearing things or having delusions or something like of that sort. So these are the main symptoms with the patient of psychotic disorder. They may be getting what we call delusions, which is fear and fixed and false beliefs, or hallucinations, which is an abnormality in their perceptions. Typically, it tends to be the visual or auditory perceptions, and which have the quality of reality. And it can be of brief period, or it can be of extended and chronic nature, as in schizophrenia. And etiology can, the reason quite vary. So let's not jump in. Okay, Dr. Adham, please tell me how far I'm going, getting on with time.
Another couple of minutes, please.
Sorry, how long?
2 minutes, please, for the presentation.
2 minutes, okay. It goes without saying, COVID-19 and how it has caused a surge in the anxiety symptoms in particular, and as well depression into a lot of people. Okay, so how do we go around promoting and protecting health? And to be fair, it's not an easy job, and it needs to be a combination of the work of governments, NGOs, and but certainly families and societies. It goes back to this famous pyramid, which our dear colleagues, psychologist colleagues work along, what we call Maslow's pyramid. Maslow was a famous psychologist from the US. That we can't go to the stage of self-fulfillment without going through more basic stages. What concerns me is the psychological needs, as in unless you give your child and give a person an intimate relationship. So for children, we look for proper attachments, healthy attachments that help a person then become healthy in his relationships outside home. Also the prestige and feeling of accomplishment, rather than sort of regularly putting down the achievements of people. Unless we have felt secure in these stages, we won't go to this stage of self-fulfillment. And there are specific ways for promoting mental health. So say for example, for children, I remember the work of Sure Start and other groups in promoting mother and toddler groups and stuff. And promoting mental health in schools, and is certainly becoming more an area of awareness in some schools, and I think here in Dubai it is the case. I just quickly will go through this. This is a white paper published by the Department of Health in the UK during my days of training. This is it makes me realize how old I am. This is back in 2009. Called New Horizons. It's a beautiful document set up by the Department of Health. It's a consultation paper for if you have gotten nothing better to read at bedtime. Probably this is a good document to read, and it really spells out a lot of good basics and standards to set up a good mental health in the society. I won't be able to go through it at all in this session, but again, talking about what can help promote our mental health, it's probably common sense things. Living healthily, eating healthily, sleeping healthily, having healthy relationships, sticking with the right group of friends, doing regular exercise. Reading is a good one. And certainly for us of people of faith, it's working on your spiritual part. I'll end my presentation with just maybe a quiz, if you can identify those, and if you can tell if they have suffered any mental health problems. Do you know who is this person? I mean the one to the left, not the one to the right. Okay, so quickly, this is a Prof. Nash, okay, a famous Prof. Nash. He was a Nobel Prize winner, and it is known that he suffered from schizophrenia. So that's to say, having a diagnosis even as severe as schizophrenia doesn't prevent a person from achieving as high status like Prof. Nash. Sir Hopkins. So openly talked about how he suffered from depression in the past. That's Ben Stiller, isn't he? Ben Stiller has also talked about how openly suffered from bipolar affective disorder. And this one, he hasn't talked yet about suffering any mental health problems so far. And these are my references. And sorry, I went above over my time.
Okay, thanks very much, Dr. Ada. It's beautiful and lovely kind of a sailing through the mental health illnesses management and a bit of insight for people who are not specialized like us. So really that's great, and actually was really keen to kind of highlight a few things and maybe ask you questions if I may. You mentioned, which is quite alarming, that suicide is the second most common cause of death amongst the age group between 16 and 25. And if I got that right, that is quite significant. And yeah, thanks so much. So that's quite significant, really. And so when you say suicidal thoughts, so what does it mean? How quantify the thoughts? How much is too much, and how risky is actually the risk of thinking towards suicide? Because if I'm sad in a day and sitting there and think, okay, I don't want this life, what is the criterion of that? And then to build this to the point, is that something, if I have that once or twice every now and again, is that something needs warrant seeking medical advice, for instance? So can you talk us a little bit through about this, please?
So having the odd time when you feel like, what's the point in life? If I just go to bed and I don't wake up in the morning, that's not necessarily something I would jump on guns as a psychiatrist about. But certainly, if there is a pattern of repeated occurrences of death wishes, certainly if there is certainly if there is a repeated pattern of death wishes, then that can't be right. A person shouldn't be feeling like life is not worth it, or I want to end my life. And this is a scenario that I would encourage anyone feeling like this to be going to see. So in the UK, I would be encouraging him or her to see the GP initially, who may wish to manage to give advice accordingly, or to refer to more specialists. Certainly what worries me even more is when a person gets what we call suicidal planning, suicidal action and suicidal planning, which I wouldn't encourage a person who's not specialized to go into it as such, because it can be a delicate area. It can be quite distressing for people around the person. But if you suspect a family member or a friend to be having some thoughts that life are not worth living, or even to the more extreme of planning something, as in sort of noticing someone is piling up pills in his room, or having razors when they shouldn't be having razors in their room, or stuff like this, then I would certainly encourage that person to be brought to the attention of professionals for advice and help.
Well, that's great. Yeah, that's great. Also, actually, you mentioned about the Maslow's triangle, and you highlighted the establishing healthy relationship for the well-being and psychological well-being and development, especially in young age, as kind of a adolescent young age, hoping to reach to the peak and the summit of the triangle of fulfillment. But can you just tell us a little bit more about what do you mean by healthy relationships? What do you mean by healthy being? I mean, how can a mental health attitude toward myself, toward others, and particularly because, and it ties to the first question really about suicide, because one wouldn't think about suicide, about about losing their lives if they are kind of comfortable and living a healthy lifestyle. So how can we understand this?
So I suspect it's two in one questions, Dr. Adham. So it's the relationships and the suicide part. Again, just to add on to what I previously said about suicidal thoughts, the most common scenario of someone presenting with psychotic with suicidal thoughts is depression, of course, but it could be other conditions like in psychosis that someone may be getting suicidal thoughts and bipolar depression. So really, once we diagnose what's the problem, comes the treatment. If it is a mental illness, then I won't be talking about treatment because, again, it's biopsychosocial and it's such a big topic and it differs from one person to another. That's in terms of this suicidal thoughts. Relationships, I'm not sure there is a black or white definition about what a healthy relationship is, but it is a relation. It's a pattern of interaction with people which gets a person to feel secure, recognized, and appreciated, not ostracized or sort of feeling like secluded and not bullied, recognized, and hence comes the later stage of feeling, yes, I'm a part of the society, I'm able to contribute and fulfill myself. So it's that sort of steadiness in the relationship, in healthy relationships, which help a person achieve his full potential.
Maybe that's very good. And actually, as an action plan or as an sorry, do you want to say something? Did you want to say something? Sorry. Sorry, you muted. Right.
Yes.
You muted.
Sorry. Yeah, so I think you can hear me now. So Mr. Ziad, in his very special practice of doing psychology, and Dr. Ahmed can also have their own thoughts within their practice.
So I'll just move on from this really to go for the kind of the third point of access of our seminar today, which is what's the roles of individuals, families, and NGOs, institutions, and society to support mental well-being, and then leading to then questions and answers, and some of the questions started coming, and I do encourage, we all do encourage, I mean, brothers and sisters to kind of put their questions on the chat section, so that we are going to kind of distribute them to our guest speakers to be kind of answered, related to. So if we go kind of sailing through and quickly touching on the role of individuals and families and institutions, I'd say in the coming 8-9 minutes, that would be great. So Mrs. Ziad, and then followed by Dr. Ahmed, if you can touch on that as well. What is our roles? What are the community? Ziad?
Yeah, so our duty as an individual and the community is to support people to be interactive in the community. So like Dr. Wael said, they need to feel they are part of this community. And I believe from my experience with these, with the mental health issues and activity and how we support them in the community, and I recognize that most of the activity happening in white community or side country community, it's rare to find it in the center or in the Muslim community, unfortunately. And I believe that because we are afraid from regulations and lack of knowledge about how to deal with the people with the mental health issue, make us avoid the activity that help with the mental health people. So we have two circles, the community organization and the individuals. For individual, I believe there's 5 things we should focus on. 1, awareness. 2nd, care. 3rd, encourage. 4, sharing. And 5, respect. Very quick. Awareness, that means you should seek knowledge about mental health by involved in training or talks or articles, reading some articles about it, and try to know better about what is mental health issue and what is mental health. And I'm encouraging mosque to have a Friday khutbah about the mental health and try to provide some specialists to give some training to public people. The second thing is care, and this meaning you need to show care for these people. Like you ask him, how you doing? Who you think will win the league this year? So try to have open question with them and make him express themselves. And with the care, you should be active listener. That you mean your eyes and your ears focus with them when they talk, and try to showing empathy if they have talking about emotion situation. Try to offer your help if they need it, and if you need help from them, it's nice to ask them for help, especially with the small and simple things, because they will appreciate it and feel they are part of the community. The third thing is encouragement, and we should encourage them to be more independent and try to rely on themselves, and they can. A lot of people who has a mental health issue, they can get married, they can live their life. So we need just encourage them to do it. We can saying, you smart, you can finish your course, or I believe you have good memory, you can memorize Surah Al-Fatiha, or you say, oh, mashallah, you lost your weight. Can you keep it eating healthy? So you're trying to encourage him and direct him with the nice, positive activity. The fourth thing is sharing. And what we mean about sharing, don't feel shame around them. Try to introduce them to your friends. Try to involve them, invite them to your occasions like walima or marriage or any other occasions. Try to invite them to your activities, going to gym or football, camping. Let them feel they are part of that community. Lastly, respect them, and this is very important. Try to don't ignore them when they talk. Don't shout or be aggressive. Don't mock or laugh on them, and don't judge upon their behavior. So that's the circle of the individual. When we talk about the community, very sorry. When we talk about the community, we have 3 important things. The first one is give a training to your staff. Each mosque, each Arabic school, or any organization community, they should have training in mental health. And there's a lot of different mental health courses, simple one like first aid in mental health, understanding mental health, skills, foundation counseling skills, or you can have like foundation and supporting skills mental health people. So there's a different courses they can take from imam and teachers or admins in organizations. The second thing in the community organization they should do, they should make their venue facilitated for these people. What I mean here, showing simple signs they can understand about the rooms and direction inside your venue. The second thing, try to have a hotline with the mental health emergency. If anyone in the area of the mosque or organization have a problem, they just call this number and specialists will link with them. Try to link your organization with the specialists or mental health organization in the city. Lastly, try to have your policy and safeguarding, risk assessment, and mental health assessment in your organization. Finally, in the community organization circle, they should have some activities, especially for mental health people. So we have a specialist organization for that, and you can do some cooperating with them to provide some activity for mental health people. Unfortunately, I found a lot of Muslim people suffering from mental illness, and they join in Christmas parties and join in the Bob's activity because there is no activity for them in the community. So we need to have a specially activity for them, and we try to do another activity that mix between people they suffering from mental illness and the normal people in the community, and like in this Arabic school parties or Quran circles, sport days. So this activity is nice to have joined between them and other young men. So that's the very quick scan about how we should do toward the people with the mental health issue. Do you want me to continue, or we can pass it to Dr. Ahmed?
Thanks so much. Really, that was that was really very good, and I think you've kind of highlighted in a very clear and targeted points the role of individuals in general and the role of the society. And to Dr. Ahmed, if you can add over 1 or 2 minutes on that before we move to questions, please.
It's going to be really difficult to follow up. I mean, to add anything after Dr. Wael and Brother Ziad, but probably the one thing I wanted to highlight is we really need to distinguish between two things, between the mental illness and the mental well-being. So the mental well-being is the largest spectrum. So someone who's really functioning very well in the community doesn't mean he's at a very good mental well-being. So people can be functioning, but they've got some problems with that. And we need to distinguish this from having an illness, which is a mental illness. So if I focus on the mental illness, I just want to be able to focus on 3 things. One of them is early recognition. So we need to recognize that there is a mental problem. There's a mental health problem. It's not only a reduction of the mental well-being, but sometimes we need to identify signs of mental health problems, I mean mental illness. And the second thing is dealing with the stigma. So sometimes people are afraid, as we said, there is a stigma around mental health and mental illnesses, and we really need to deal with that. And the third thing is, thinking about how to support those people. So very quickly, if we think about the first element, which is early recognition, a normal person should be able to do 4 things. You should be able to work. You should be able to think clearly. You should be able to control your emotions, and you should be able to build relationships. If you've got any problem in any of these 4 areas, it means there is a possibility of mental illness. If you think you're unable to work because any problem, you don't have the energy to get up and to go to work. If you've got a problem that you can't think clearly, you're preoccupied and worried about anything, that might be a symptom of mental illness. If you're unable to build a relationship with your partner, with your colleagues, with the wider community, there might be a problem. And the whole thing is your ability to control your emotions. If you think you're becoming upset, irritable, and you can't really control your emotions, you can't control your behaviors, you can't control or you can't stop watching porn, you can't stop using drugs, you can't stop smoking. If you can't do any of these, there might be a problem. So that's the first bit, which is identifying there is a problem. The second thing comes the stigma, and that's what probably Brother Ziad said. We need the community to understand that we need to reduce the impact of stigma on those people. So we need to support them. We need to always tell them mental illness is not a stigma. It happened to many people. You really need to seek support instead of being stigmatized. And finally, giving the support.
Sorry for interruption. So, Darsh, can you just explain in simple language what does stigma mean, so that we follow you clearly? What does stigma mean?
So the stigma is basically what we call in Arabic the wasmat al-ar. So I mean, if you've got a mental illness, the people tend to feel that they're stigmatized. I mean, they've got something wrong around them. So if you've got headache, you can openly talk about it. So you can say and you can share with your friends and your family. I've got headache. I've went to the doctor. And I've gone to the doctor and he prescribed blah, blah, blah. But if you've got a mental illness, you feel that you're stigmatized. You've got something really bad and you don't really want to share it. And that's the problem, because when you become stigmatized, you tend to isolate yourself because you feel there is something wrong with me. That doesn't happen to everyone else. And that's the role of the community leaders, to overcome this stigma by normalizing it, say this is normal, it happens to everyone around you, it's not only you. So we've got loads of people around us with mental health problems. It doesn't mean you're different, doesn't mean you're bad. So that's the stigma bit. And as I said, that here comes the role of the community leaders. And finally is giving support. So so it's not enough not to stigmatize people, but also we need to extend a helping hand to them. If you've got a partner, if your wife, if your husband having mental health problems, you shouldn't be judgmental. I mean, even if you can't really help him, but at least try to be supportive as much as you can. I mean, don't judge him badly. Try to help him, encourage him to seek help, try to encourage him or her to be compliant with her medication, with her treatment regimen. Give all the support you can to people around you. And here comes, as I said, the role of partners, the husband, the wife, the father, and the children, the mother and her daughters. You need to be really supportive and open to your children and to people around you. There's just like a summary and how I see how we should go forward in this area, like identifying, dealing with the stigma, and finally giving the support as much as we can.
That's very good. Mashallah, it's really great. And without knowing, actually, the hour has gone. But I am actually keen that there are few questions that we need to kind of tackle, because this is basically when we pin problems to. So for instance, we'll start going through Q's and A's for the coming 10 minutes. So, Brother Ziad, I mean, what's our role if our family has got someone who's got a mental illness, and then we're concerned about social services coming into place, and then are they gonna kind of take over our children, and we're gonna be kind of deprived from this bond, you know, the kind of the paternal to kind of children relationship, and this fear about whether social services is gonna kind of take over things, or are we gonna be seen as inadequate, inappropriate parents? So how can you comment on this? What is our role and what is our understanding between our upbringing, our children, our behavior with them, as opposed to the concern about the impact of the social services?
Yeah, so we have two ways. The first one, you keep it in the house and don't say it to anyone, and try to deal with it by yourself. And after this, you've been stressed and aggressive, and then after this, they will come to you and they will find it. They will find you being aggressive with them, and you can't deal with them, and then they will take your child from you. And after this, you can't see your child. And I found this a lot in the Muslim community. I know one who supports recently. He talked from his family when he was 13, and now he's 27. And he celebrating Christmas and the Easter, but he doesn't know anything about Ramadan or about Eid or other things. So that's the first scenario. The second one, when you find any problem, like doctors said, you straight away go into the GB. If you find he has maybe like signs of autism or bipolar or other psycho issues, you straight away go to the GB and try to ask for awareness and training to how to deal with your child, because you have the right to have these trainings, and they can't take it from you. If your child is okay to be in a community, they're not taking it from you. You can training yourself, and they will stay with you, and you can deal with them. But if you just keep it in the house and you not want to seek help from professionals, you will find yourself in the end your child will be taken from the social worker.
So the message that you want to share with us is that be open, be truthful, and then seek support. And then this is not going to be an avenue for any adverse outcome. It's going to be really a means of kind of getting a healthy lifestyle for both parents and children.
Yes, and a social worker and the mental health system in UK is very, very quality system compared with other countries, and they want to help you and help your family. They not want to take your child because they have loads and they have shortage of staff, like doctor said. So they doesn't want to take your child, but they just need your support and help. But if they doesn't trust you raising this child, they will take it. They will take it from you.
Right. Great. Thanks so much. So, Dr. Ali, you mentioned about the origin of the mental health as a kind of a social and environmental illness. And so when you talk about genetics in families, and people might have kind of in genetic makeup, they've got kind of mental illnesses running in families. So one is that, okay, how can we help this? Can we do anything to adjust or modify the risk factors, the genetic risk factors, in order to try to optimize the outcome of the person? Two is that, okay, so if I know then in my family that there is some genetic component, so what's going to happen when I kind of go forward and make a family, or seek kind of getting a husband, getting married, getting children, and then my worries toward the coming generation. So how can we go about this?
Such an important issue and question, Dr. Adam. While we do believe that there is certainly a genetic component into some of our mental illnesses, having said that, till this very day, I don't think there is anyone who can say with any certainty that this chromosome is particularly related to this illness. And some people say for condition like schizophrenia, chromosome 11, long arm, has got some part of the correlation or the causality of psychosis. But I'm not aware of people going systematically through genetic screening because of having mental illnesses, nor there need to be a panic because I have a mental illness, therefore it's over for me, I can't marry, I can't get children. It shouldn't be. But we start from the basics. If you have got a diagnosis, if you have got an illness, then you need to get it treated, because you can't get into a marriage relationship or be a proper father or mother when you have got an illness which is not treated. So let's start with basics, getting a diagnosis made and getting the treatment done for it. As I was saying early, in most cases, or probably in the science of psychiatry in general, we take a biopsychosocial approach. So bio, as in genetics, is only a part of the bigger picture. So that's to say, I may be born with some of the genes of developing psychosis later on in my life because first degree relative, my father, say for example, had the illness. Okay, that doesn't mean that I will develop the illness. That's only one factor. When the gene is going to turn on and produce the illness is a totally different matter that depends on lots of things like early upbringing, like stressors later on in life. So, I'm just trying to convey that it's only a part of a bigger picture. I always remember from our earlier days of learning to become members of the Royal College, fact that even in mono-identical twins, so identical twins, so monozygotic identical twins, the chance of your identical twin getting the schizophrenia is only 50%. So that is your identical twin has got your same genes, his chance of getting the same illness is only 1 in 2. So it must be something that's beyond genes. It's a collection of lots of things. So I hope that answers your question, Dr.
That's great. Thanks so much. It's really a very important point. Now, if I move to Dr. Ahmed, I mean, as Muslims and in Ramadan, and then we believe in Allah Subhanahu wa Taala, and then we believe that Allah Subhanahu wa Taala says, وَنُنَزِّلُ مِنَ القرآن ما هو شفاء ورحمة, and we believe that Prophet صلى الله عليه وسلم كان إذا حزبه أمر فزع إلى الصلاة, and Prophet صلى الله عليه وسلم كان يقول وجعلت قرة عيني في الصلاة. So where can I place this in the mainstream, in moderation, rather than being extremist in one end and saying no, it doesn't happen, ma'adallah, and then everything has to be medicine, science, and evidence-based, current modern psychiatry, or the other extreme to say, well, as long as I'm praying and reading Quran with reflection, and I'm not getting no depression, I'm not getting any mental illness, I'm not getting any anxieties, I don't have any stress to cope with, or to have to cope with. So where should we find really the place, and particularly that your foundation is called La Tahzan? I think that you've got the quote from the Quran itself. So how can I really understand that and not fall in one of the two extremes?
Sorry. Thank you for the question. I think that this is an important question, and I'll answer it on two lines. On one hand, we know in psychiatry, in modern psychiatry, that the spirituality is becoming an important part of the practice. So we know that how spirituality can affect the how people feel in general. And I think even in the Royal College, we've got a special interest group, a group of psychiatrists who are really interested in studying the linkage between spirituality and psychiatry and the mental well-being in general. So that's on one hand, but having said that, we need also to distinguish between the mental well-being again and the mental illness. Spirituality can help with the mental well-being, so you will feel better in yourself. So you can deal with certain stressors using spirituality. But if you've got a mental illness, it's kind of a diagnosis, if you've got a problem. So normally we know that the mental illness is linked to at least some functional and structural changes in your brain. So it's not as simple as just like dealing with it in spirituality. So you might need an extra hand. So you might need some medications, you might need psychotherapy, you might need other types of support. But so the point I want to make clearly, spirituality, thinking about Allah subhanahu wa ta'ala, being grateful, being thankful to all the ni'am, to all the things that you've got, will help your mental well-being. So it will help what we call resilience. So you will be able to overcome the some traumatic experiences you might have in life, some of the stresses you will face in this life, you will be able to overcoming using spirituality, using different techniques. But if you've got to the point where you've got a diagnosis of mental illness, you need really to have something extra. So, and that's this matter I really want to forward to many of our sheikhs and scholars, because sometimes they've got the feeling that spirituality can deal with anything. So no, you're all right, just like read Quran, do your prayers, do your askar, and you will be fine. So my position on this, it will help if you don't have a mental illness. It might help if you've got a mental illness, but it's not the right way of treatment. You might need something extra. Think of it as someone who's got like cancer or something. Spirituality might help with his emotions, it might help with his immunity, he might get better, but this is not the main line of treatment. So you need to go for a surgery, you need to go for another intervention. And that's what Allah subhanahu wa ta'ala and the Prophet asked us to do. So Allah subhanahu wa ta'ala, Prophet asked us to seek remedy, tadawu. So, and that's what we need really to encourage people to do. So that's like in a summary, the relationship between spirituality and the mental well-being in general, and the message I wanted to convey about the mental illness. It might need really more than spirituality.
Well, that's really very clear, and then really puts things on their own right and the right place. That's really very informative. Thanks very much. Can I just take a little pause because I can see that we're alhamdulillah we're running over time, but I think all the topics are quite lively. So we're gonna resume back the Q&As, but we'll have a brief pause to kind of kind of pronounce and to kind of say and communicate to our beloved Liverpool community that we are part of. That's alhamdulillah, it's really a great initiative that your guest speakers, Dr. Wael, Dr. Ahmed, Mr. Ziad, along with Dr. Dua Al-Adawi, they have kindly agreed to kind of take on an initiative whereby they are happy to give us a hand and lend a non-profitable advisory hub. And this is in no way a replacement to the NHS services, in no way it's a replacement to seeking the GP and specialist psychiatric advice. It is just an extra pair of hands to our society, and to take things from the level of awareness and ideology to the level of practicality and to the level of the actual support in a way of a project. So what we're saying here is that there is an initiative, and inshallah ta'ala is gonna the details is gonna be kind of publicized after Ramadan, but it is in broad terms, it's a non-profitable, it's an advisory hub with obviously with limited kind of range of time that our dear professionals are able to kind of provide in order to support our community. And in a way, it is kind of a signposting what should we be doing for if we got some sort of a concern about mental health issue, and it's not an open clinic, it's not an online website to treat everything and everyone, because obviously this is very much beyond our resources, and we're not as it stands. So this is what we're alhamdulillah, I mean, I'm very, very fortunate to have this this group of high standards of our society, our speakers, along with our sister Dr. Dua Al-Adawi. So Jazakumullah khair. Thanks very much. We'll move on to pick another question. If I'm in, this is an open question for everyone, and probably that can be the last question, just concerned about time. In a family, for instance, we might see, rightly or wrongly, as a perception of parents or siblings, that a family member has got some sort of a mental support and ill recognition and talk therapy and all that. But is it, if I'm a parent and one of my children, he or she, that I'm concerned that this type of behavior doesn't seem to be right, but I'm not 100% sure really about this. So should I just go confronting it, correcting it? Should I embrace it and kind of and all the emotions, and then kind of try to have this as a replacement to seek? What is the first step that I should relate to my children in this particular way? And can I start by you, Dr. Ahmed, and then Dr. Wael, and then Brother Ziad?
So my main advice would be: do not treat your children. If you've got a child with a mental health illness, do not try to treat him yourself, because that breaks a lot of things in the family. So if you've got a problem, say with your child, try to seek help, try to seek advice from a professional. Do not try to treat it yourself, because as I said, you're gonna get it wrong anyway. So if there is a problem, if there's a mental health illness, don't try to do it yourself. That's number one. The second advice, focus on the trust, building trust between you and between your child, or between you and your partner, if the problem with your with your partner. So building trust is really important, because we know that the family support around the patient is really, really more important than the meds, the medications we give. So if we lose that family support, if the relationship between the patient and his surrounding, like the family members, becomes tense, stretched, a lot of arguments, a lot of disagreements, that really goes beyond anything the medication will be able to help with. So try to build the trust between you and that member of the family. Do not get into altercations, into arguments, or into disagreements. Try to keep the relationship as good as possible. I mean, you can always voice your concerns to your child or to your partner. I think I've got some concerns about your mental health. That's absolutely fine, but do not try to fix it yourself. I mean, be supportive in terms of, I think you need to see your GP. I think you need to seek an advice from a psychiatrist. But try to keep the bond in this family relationship as safe and sacred as much as you can, because if this is broken, it's going to be really difficult for any psychiatrist, for any psychotherapist, for whatever professional to help or to fix this broken relationship. That's kind of my second advice. My third advice to families is be open, and that doesn't happen at once. I mean, it's a kind of a process, really. So it starts from the early childhood. If you have never listened to your children, it's going to be difficult for them to open to you. So you need to have an open relationship with your children since the very early ages. It's very difficult, really, when I see someone coming to me and then complaining about a 20-year-old daughter, a 20-year-old son, and then they start like complaining about him. It doesn't start when they are 20. It starts when they were 1 or 2 or 3 year old. So you need to start very early, and that's the kind of an advice I want to really convey to any couples. I mean, planning for the marriage. Really start early, start to build this relationship with your children, because that helps when they get older, when they go through the turmoils of adolescence, when they go through difficult periods in their life. So try to start early, and don't just like think, oh, this is a problem now. So normally the problem would have started many years before. So that's kind of the main 3 advice that I really want to give to any family. Do not try to fix the problem yourself. Try to emphasize and keep the relationship as healthy as possible. Try to be supportive as possible. And number 3, try to start very early. Build this relationship when it's a good time to do it. Do not wait until it becomes broken.
Thanks very much. I'll take number 1 and 3 points to Dr. Wael, and I picked that to raise the question. Really, is so Dr. Wael, if we was Dr. Ahmed, you're still muted, by the way. Was Dr. Ahmed very cruel in saying don't treat your children? Because moms can say, well, we know our children more than any doctor. We know our children more than any other experts, because we raise them. We know their inside out, and we know how they feel and how their emotion, and they feel very comfortable dealing with us. So I can go as a mom or as a dad to courses, and then gain such an expertise, and then manage my children as much as it can be, without taking them to an uncomfortable zone of having to sit in front of someone that they haven't met before, and being stigmatized as having some sort of a mental health issue. So this is number 1. I need your comment on it. Number 3 is basically said, okay, you build your relation from the very early age, and 100% agree with that. But is it too late to try to rectify some bonds between parents and their children, or that's once it's not there, you can never reform it? So these points, if you can comment, please, Dr. Wael.
I think what Dr. Ahmed was meant to say was using the parenting skills. So it's using the proper parenting skills that as relevant, and there are the subspecialty of child psychiatry is quite a beautiful subspecialty on its own, because not only that you are in involvement with the child on your own as parents, but also you have got a different other set of people with special interest in the care of your child. That's namely teachers in particular, and this is a great wealth of knowledge for you to know more about the condition of your son. And I like to think about it as being sort of detective in a gentle way, sort of being detective without sort of particularly getting your son or daughter to be worried about something going wrong, or to start hiding or whatever. So working with whoever who's involved in your son's or daughter's care to know if there is a problem before you say, hang on, I've got a problem, and now I want to take a step forward to address it. Talking about parenting skills, in case you are fearing that you may be misusing powers or stuff like this, especially for the younger group of children, there's something called Webster's Stratton kind of course, which gives nice set of skills for parenting if we are suspecting that our skills can be better delivered, kind of thing. So I can't comment on just what pattern of behavior is right or wrong, because again it needs to be taken into context, kind of thing. This is in terms of the parenting. Again, it's working really with other people involved in the care of your son or daughter, being curious to know more about what you are suspecting. So if you are suspecting your son may be hyperactive and impulsive in their decisions, I encourage people to go on the Royal College website, because there is a set of beautiful leaflets about different conditions set up for parents and carers. They can learn a lot about conditions and how to help out their beloved in dealing with these problems. So that's one, the first point. And remind me, I'm sorry, my glucose is running out there. Remind me of the second point.
The second point is actually establishing the bond. I suppose that this bond of building trust and being actively listening, embracing, was not the optimum, and then you as a parent want to kind of address that at a later stage. Is that still possible, or that this is kind of an irreversible kind of damage that has happened?
Thank you. It's never too late. That's the message. It's never too late. Yes, while the attachment style and attachment, good attachment is quite important for the later on well-being of your child, but that doesn't mean that if there was an issue affecting the quality of the attachment earlier on, that you can't undo it. You just need to start from the here and now. And maybe if there was some shortfall in your quality of care, some kind of bravery, some kind of assertiveness in sort of addressing it and turning things around. But it's never too late. It's never too late.
Thanks so much. So moving to Mr. Ziad, if you can just give some sort of a practical or example from a day-to-day practice as in addressing.
Yeah, so for the families, my tips for them, if you have a child with a mental health issue, there's some certain stuff you should be aware about. First, you need to be patient and calm all the time. anytime you feel, even if you're not showing it, but they feel it like a child. People with a mental health issue, they sensitive with your emotion. So you try to be calm and try to be patient and calm all the time. The second thing, try to encourage him to be independent in the house. So if don't clean his room or tidy his bed, no, let him do it. Even if he's struggling, try to teach him or learn him how to do the daily things, the daily activities. To try to make him as a part from the family, do stuff, doing shopping, cleaning the yard, doing the stuff that feel him he's a part of this family, and don't feel him that always he rely on his mother or on his father. The third thing is try to setting some rules in the house, because sometimes people with a mental health issue, they need the rules to follow, because they doesn't understand if it's that right or wrong. So try to put the clear rules in the house, they can follow it and guide him. Fourth thing, and this is very important, try to put emergency plan in the house. If it's fire happening or any certain crisis happening in the house or in the public area, if you lost him, what he should do. So you try to put a plan and try to teach him how to act in this plan. Last thing, for parents, for parents who had people with a mental health issue, or any parents, they should look after their well-being. When you do parenting, you always have stress, and most stressful people who has a children and raising children, because it's a big responsibility, and you try your best to your child be a successful person in the future. So you have loads and pressure from the community, from your family, from all the circle around you. So this stress needs relief. So you need to have some time to yourself, relax, and try to look after yourself. And if you're feeling struggling to do it by yourself, try to seek for advice or counseling that he can give you some solution and relax time. So I believe that what I can give to the families.
That's great, and actually that takes us to the conclusion and the end of our seminar, which has actually extended half an hour beyond the allocated time. But I believe that it touched on really on very important, vital issues that we face as individuals here and now in Liverpool, and maybe similar societies as well. So I can only ask Allah subhanahu wa ta'ala to reward you highly in Ramadan, Brother Ziad, Brother Ahmed, Brother Wael, and all the brothers and sisters who actually kind of maintained and founded this initiative and prepared for such a very vital and important topic. So may Allah subhanahu wa ta'ala reward you immensely, reward you heavily. May Allah subhanahu wa ta'ala maintain the well-being and peace and happiness at your homes, your families, at workplace, and societies and communities. May Allah subhanahu wa ta'ala makes you all the time means of mercy, support, and care, and looking after to all of us in the community who will need your expertise, and have that for the sake of Allah subhanahu wa ta'ala. Really a huge thank you for your time and effort, especially in Ramadan, when you probably want to go for your qaylula and have a bit of a nap, but you elected to have another way of self-fulfillment and self-reward by actually having this high impact on our lives, his lives as well. So Jazakumullah khair. Well, that takes us to the end, and again to reiterate what you have kindly came forward to do, which is an initiative in Liverpool in a way of non-profitable hub of for advice in terms of the psychology and signposting. And as we mentioned, we reiterate again that this is not a replacement. This is not a switch off from the official and the NHS systems, but this is an extra pair of hands being delivered by our guest speakers alongside Dr. Dua Al-Adawi. So Jazakumullah khair. Thanks very much. This is I feel very fortunate having you and received a lot of blessings and information and insight about this very vital topic. Jazakumullah khair. And inshallah ta'ala, may Allah subhanahu wa ta'ala bless you and accept your siyam, accept your qiyam, and accept Ramadan and raise your a'mal and make that a continuous charity till the day of judgment. جزاكم الله خيرا. نختم إن شاء الله تعالى. سبحانك اللهم وبحمدك نشهد أن لا إله إلا أنت نستغفرك ونتوب إليك. أعوذ بالله من الشيطان الرجيم. والعصر إن الإنسان لفي خسر إلا الذين آمنوا وعملوا الصالحات وتواصوا بالحق وتواصوا بالصبر. صلى الله وسلم وبارك على نبينا محمد والحمد لله رب العالمين.